Support for WUWM podcast comes from Hop Harvest and Vine and Good Harvest Market in Milwaukee, part of One Destination, combining farm-to-table dining, local craft beers, and organic groceries under one roof. More at goodharvestmarket.com.
You're listening to Lake Effect Spotlight from WUWM, Milwaukee's NPR station. Here's one of our favorite conversations about the people, places, and organizations that shape Milwaukee.
The air quality in Milwaukee reached historically hazardous levels last week, and while it's gotten better, there are still reasons to be cautious. Wildfires in Canada continue to burn across Ontario. Some health experts are advising people to stay vigilant, with the potential for more smoke spreading over the Midwest. Dr. Ben Weston is Milwaukee County's Chief Health Policy Advisor. He joins WUWM's Eddie Morales to talk about the effects of short and long-term exposure to wildfire smoke.
We had such terrible air quality at the end of last week. I mean, we hit well over 500, which is just unprecedented numbers for our region. It's the highest we've ever recorded in this area, in the Milwaukee County area. And so I think that was so bad and so extreme that kind of anything feels better now. So for most folks, this is going to be all right. But for people who do have lung disease, who have asthma, or who have heart disease, this still may be weather that's going to strain their condition and make it worse.
How can wildfire smoke cause health issues exactly? And is there a level of exposure, say over a certain period of time, that it's really important for people to be conscious of while they are outside?
Yeah, so what happens when we have the wildfire smoke is we have these PM 2.5 we might have seen in the news or on the weather sites. And really what these are very small particulate matters that come in the smoke. And the problem is that when you breathe in, these are getting deep into your lungs, and they can cause irritation and inflammation inside your lungs. And when it does that, there's short-term as well as long-term consequences to that. So most of us are feeling the short-term consequences of that. And certainly last week, it didn't matter what physical condition or what health conditions you have. If you were outside for even 30 seconds, you'd feel that your lungs were starting to burn. You might feel like you need to cough. Things just felt a little more uncomfortable. You might also notice your eyes were burning, things like that. And when you have those extremes, it hits you really quickly. Now, most of us aren't necessarily going to feel it. We'll see that it's a little bit misty in the air or a little bit smoky in the air. You might smell it a little bit, but it's not going to affect, especially just walking around, our respiratory status as much. But for kids with really small airways, especially really young kids like babies, for older adults with more fragile airways, and certainly with people who have that lung disease, where even a little bit of inflammation in their airways is going to cause a big change, they're still going to feel it. But those are short-term effects. We also have the long-term effects. And over time, chronic exposure to levels of smoke like this can not only worsen some of those lung conditions, but can actually cause them. Now, thankfully, here in Wisconsin, it's pretty intermittent that we have this sort of smoke. And so it's not something that we're doing on a day-to-day basis. And so we don't worry as much about those chronic issues. But certainly in the short term, we do have lung issues that arise from the smoke.
Yeah, and so what are the precautions that people can take, both inside of their home or inside of a building, but also when people do step outside? And could you give specific recommendations on things like masks and air purifiers?
Yeah, absolutely. So especially when the smoke levels are getting higher and you're starting to feel the effects of it, there are certain things you're going to want to do. So staying inside is the easy one, especially if you have air conditioning or an air purifier. Now, we know not everybody in our community has that, and so the situation is going to be different for different folks. But if you do, that's a pretty safe environment. If you keep the windows and doors closed, you're running your air conditioner, you have a good filter in that air conditioner, or you have an air purifier that's running, you're going to keep a lot of that particulate matter, a lot of that smoke out of your house. And the same thing goes for a car. Cars can actually be one of the safest places to be if you have the windows closed, you have your air conditioning on, and importantly, you have it on recirculate, that little picture of the car with the circular arrow that we really never use and maybe don't even know what that does. That recirculates the air rather than bringing in new fresh air from outside. And it's also a good time to check your cabin air filter to make sure that air filter in your car is actually filtering out some of this particulate matter. But some of us can't stay inside. People have to work outside, or they don't have a living environment that necessarily has that air conditioner, that air purifier, and you just have to be exposed to the air. Now, in those cases, you want to still try to minimize exposure. Sometimes that means going to public places where, like a mall or a library or a community center, where that air is filtered, especially to get out of the smoke. For others, it might mean a mask, especially people who are more sensitive to those high smoke conditions, or when the smoke just becomes so extreme, like we saw last week. We saw a lot of people wearing masks. Now, one of the important things about masks is it really has to be a high quality KN95 or N95 mask. And it has to be well fitting. The cloth masks, the simple surgical masks, those just aren't really going to do much of anything when the smoke is out. And really the sign of that is you shouldn't be able to smell it, because if you're smelling it, those particulate matter is getting in. And so you want a well-fitting N95 or KN95 mask where you can't even smell the smoke anymore. And then you know it's filtering effectively.
How about when it comes to like furnace filters? Should people be doing anything outside of the regular maintenance for those during times like these?
Yeah, it's a good question. So you can get HEPA filters or higher level. MERV is the measurement, so MERV 13 or higher. Those are going to be really effective of pulling these particles out of the air in your home. Now, if you're recirculating the air in your home and you keep up with your filter and it's not quite up to that level, it's still going to do a pretty good job, because a lot of that smoke isn't coming into your house if you have your windows and doors closed. So I wouldn't necessarily, if you have trouble affording it, I wouldn't run out and buy a HEPA filter. But certainly for people who are sensitive to smoke, or if you're just sensitive to other things, allergens in your house, maybe pet dander that you have in your house, things like that, it is a good investment because it is going to keep the air in your home quite a bit cleaner. And generally, you're going to want to change those twice a year. So maybe when you turn back the clock, or spring and fall, are good times to change the air filters in your furnaces to keep all that particulate matter, whether it's smoke or anything else that might bother your lungs, out of the air.
If there's anything else that you'd like to talk about that maybe I didn't ask.
Yeah, I mean, I think the last thing is whether it's smoke in the air, whether it's extreme heat, or in a few months, whether we're talking about extreme cold, just keeping in mind that not everybody has the same resources. And so reaching out to coworkers, to neighbors, to family in particular, and making sure people are okay. If you have an older member of your family who's more vulnerable, if you have somebody who doesn't have the same resources to stay warm or stay cold or whatever the case may be, reach out and see how you can help make sure they're doing okay.
Dr. Ben Weston is Milwaukee County's Chief Health Policy Advisor. He spoke with WUWM's Eddie Morales.
That was the Lake Effect Spotlight podcast. It comes from your local NPR station, WUWM. Subscribe to the Lake Effect Spotlight podcast to hear more great stories about Milwaukee.